Minister of Education, Youth and Information Favour Williams announced that come 2022, Jamaica TV will go digital.
The most important reason to make the switch to a digital signal is because it will free up valuable portions of the broadcast spectrum, which can then be used for other purposes.
Jamaica on Monday recorded one more COVID-19 death, pushing the tally to 339 with 141 new cases, with ages ranging from 36 days to 93 years old, pushing the total to 15,153. Jamaica has started discussions with China, Cuba, and India about obtaining COVID-19 vaccines from those countries when they become available.
During these meetings, we have expressed Jamaica's interest in obtaining vaccines from those countries once they become available and are safe for our population. These countries are well advanced in the research and clinical trials of their vaccines.
And starting today, all travelers to the United States, including its citizens, are required to provide a negative COVID-19 test to be allowed entry into the country. Good evening. Jamaica on Monday recorded one more COVID-19 death, pushing the tally to 339. The deceased is a 61-year-old female from St. Catherine. One other death has been listed as coincidental, and 2 other deaths remain under probe. Meanwhile, there were 141 new cases, with ages ranging from 36 days to 93 years, pushing the total to 15,153, with 2,725 being active. Of the new cases, 71 are males and 70 are females. In the meantime, there were 22 more recoveries, increasing the total to 11,911. Some 99 persons are in hospital, with 23 being moderately ill and 11 critically ill. The Department of Correctional Services, DCS, is grappling with another outbreak of COVID-19 within its facilities, with the department reporting 21 cases of the respiratory illness inside the Tower Street Adult Correctional Center in downtown Kingston. According to Director of Medical Services in the DCS, Dr. Donna Michelle Royer-Rowe, quote, "The medical team carried out a testing program involving 65 persons from the correctional center on Saturday, January 23. These tests were carried out after contact could not be established between a positive inmate and active cases in the facility last week," end quote. The medical director added that a total of 57 inmates and 8 members of staff were swabbed utilizing a 1 in 3 sampling method to determine the spread of the virus within the facility. Results have been received for 61 of the tests done, of which 21 are positive. The department also advises that the majority of the confirmed cases are presently asymptomatic. Jamaica has started discussions with China, Cuba, and India about obtaining COVID-19 vaccines from those countries when they become available. Health and Wellness Minister Dr. Christopher Tufton said the government has met with the respective ambassadors and expressed interest in obtaining the vaccines as Jamaica looks outside of the COVAX facility for additional options.
In terms of the arrangements outside of COVAX, further to the announcement that Cabinet had given approval for the Ministry to source safe vaccines from other facilities outside of the COVAX facility, I am pleased to announce that meetings have been held with the ambassadors of China, Cuba, and India respectively. During these meetings, we have expressed Jamaica's interest in obtaining vaccines from those countries once they become available and are safe for our population. These countries are well advanced in the research and clinical trials of their vaccines. Our number one priority, ladies and gentlemen, remains the safety of our people and the government through the Ministry of Health and Wellness. Therefore, we will continue to seek out all avenues to ensure the best health outcome for every citizen. In closing, I want to again underscore the importance of members of the public adhering to the COVID-19 protocols that we have put in place to reduce the spread of the virus. I think Jamaica remains in a state of readiness to respond, but we are also in community transmission, and every Jamaican has the responsibility, therefore, to cooperate with the government to take personal responsibility to protect themselves, their loved ones, and their communities and the country.
Dr. Tufton said during yesterday's virtual press briefing that a sensitization training of health teams and a campaign is to be launched for the public on fundamental vaccination information.
We have already begun to sensitize our healthcare team through several sensitization sessions held with over 200 healthcare workers. The sessions have included information on the COVAX facility and the vaccines and the interim national vaccination and deployment plan. So we're addressing our internal stakeholders. The ministry has also begun the process of recruiting a communications consultant to lead the process of a public education campaign. While that process is ongoing, we have started the sensitizing the public on fundamental vaccination information and advertisements in the print media and on social media. In the coming weeks, we will also roll out a CAP survey to assess the knowledge, attitude, and likely level of acceptance with respect to the vaccine. A lot of work, ladies and gentlemen, is being put into this plan, and as much as you see, there's a lot more taking place that you will not see in terms of the coordination to ensure that the plan can be implemented efficiently.
Dr. Tufton said through COVAX, the vaccines that would most immediately be available will be AstraZeneca and AstraZeneca Serum Institute of India.
In terms of an update on the COVAX facility, we have been advised that the vaccines that would most immediately be available to us under the COVAX facility will be the AstraZeneca and the AstraZeneca Serum Institute of India. This availability is pending emergency use listing from the World Health Organization. The expectation remains that it will be available for delivery during the first quarter, as we have said, meaning in April. The AstraZeneca vaccine requires cold chain capacity that we already have in country, and transportation and storage of these vaccines would be reasonably accommodated. Thereafter, the next vaccines that become available through the facility would be the Novak, Johnson & Johnson, Janssen. And the same process would follow in terms of what is required, in terms of educating or informing the public and coordinating with our various stakeholder groups.
Meanwhile, Chief Medical Officer CMO Dr. Jacqueline Bisesa McKenzie advised that, according to current information, some of those who are immunized against the coronavirus can still transmit the virus. Therefore, everyone, including those immunized, should follow the safety protocols.
Persons who are vaccinated are still required to adhere to the infection prevention and control measures, which are the wearing of the mask, the physical distancing, the hand sanitizing and environmental sanitizing, as well as to stay home if they have any symptoms. Remember that not everybody who is vaccinated will not get COVID-19. There are still a percentage of persons who will have the infection. And even though we have seen up to 95% efficacy in some of the vaccines reported, 5% of a large number is a large number. So there are still going to be a significant number of persons who may develop COVID-19. And so it is very important that you still adhere to the precautions. In terms of quarantine, It's very difficult at this time when we don't have all the information on all the vaccines. We have information so far on 2 vaccines, the Pfizer and Moderna, that indicates that for the Pfizer, it takes up to about 7 days for persons to start developing immunity, and for the Moderna, 14 days.
Starting today, all travelers to the United States, including its citizens, are required to provide a negative COVID-19 viral test to be allowed entry into the country. The test will only be accepted if taken within 3 calendar days of travel. All airline passengers to the U.S. ages 2 years and older must provide the negative COVID-19 test. With the increase in online activity due to the COVID-19 pandemic, the Jamaica Cyber Incident Response Team, JACERT, is urging persons to be extra vigilant in order to guard against cyber threat. According to head of JACERT, Lieutenant Colonel Godfrey Sterling, quote, "From schools to businesses and even the hustlers on the streets, everyone is going online. Therefore, the potential number of cybercrime victims has increased exponentially since the early days of the pandemic," end quote. He said that the government continues to develop a robust cybersecurity framework geared at protecting the nation's interests, and noted that the partnership of citizens and businesses is critical in order to ensure the effectiveness of the measures. Lieutenant Colonel Sterling said that knowledge of the Cybersecurity Act is one way businesses and citizens can protect themselves against falling victim to cybercrimes. In other news, Minister of Education, Youth and Information Favour Williams has announced that come 2022, Jamaica TV will go digital.
The most important reason to make the switch to a digital signal is because it will free up valuable portions of the broadcast spectrum, which can then be used for other purposes, such as for advanced wireless services, for dedicated educational channels, public and safety services, and other applications. For example, broadcasters could dedicate some of the excess capacity to educational programs for each grade level during school hours without interrupting their regular programs. It also means that Jamaicans who do not have access to getting TV content via cable or the internet will be able to enjoy more channels with better quality with their over-the-air TV sets when the switch to digital is complete. The following are the standards which were recently approved by the Cabinet. We'll start with the television presentation format. Television presentation format will be high-definition standard technology that will provide significant improvements in the quality of what Jamaicans will see on their over-the-air TVs. For video compression technology, we have decided on MPEG-4, which is Moving Picture Experts Group, MPEG-4, which can provide twice as many programs in a given transmission channel.
In making the announcement in the House of Representatives today, Minister Williams said, come January 2023, analog free-to-air will be turned off permanently.
Utilizing a single infrastructure for broadcasting television content will significantly reduce the cost to broadcasters, including the cost of electricity. In terms of how digital switchover will be rolled out, it will be rolled out in stages with the initial focus on the main urban centers beginning in January 2022. Broadcasters will be allowed at least 1 year of simultaneous digital and analog broadcast to give them time to change their equipment and test the new system. Analog switch off is set for January 2023. Broadcasters that currently operate their own transmission networks will be allowed to continue to do so subject to their submission for regulatory approval of a promise of performance for the service to be offered, along with a technical plan and evidence of adequate financing. The licensees must specify mandatory carriage for a specified level of free-to-air and public service broadcasting. Provision must be made for the inclusion of at least one government-designated public broadcasting service to be provided on a cost recovery basis. The licensees should also allow for the delivery of television services across platforms and devices and support non-traditional additional services in the future. In closing, Madam Speaker, I would like to affirm that the digital switchover for Jamaica will help to position the country as a leading technology-enabled society in the Caribbean, thus bringing us closer to achieving our goal of becoming a digital economy.
And the management of Mello TV welcomes this announcement and are excited about the new technology and are looking forward to continuing the advancement of TV broadcasting as we are digitally ready for the future. In other news, Prime Minister Andrew Holness says the killing of 4 homeless men and the severe wounding of 2 others represent a new kind of savagery, especially given what appears to be the serial nature of the attacks, which call for a new kind of policing. He said, quote, "We will spare no effort in investigating the heinous and barbaric murders of these men who are among our society's most vulnerable," end quote. Meanwhile, Prime Minister Holness says the plight of Jamaica's homeless population has been brought into sharp focus once again, saying, quote, "We have been working to address the problem of homelessness in Jamaica, particularly in downtown Kingston, where we recently established drop-in centers. Now we must redouble our efforts to ensure that this vulnerable group is properly provided for and that there are more clean, safe, and accessible places for them," end quote. The Prime Minister said the matter was discussed at length during yesterday's meeting of Cabinet, in particular with the Minister with responsibility for local government, Desmond McKenzie, as well as Mayor of Kingston, Delroy Williams, who are currently exploring further ways of providing service and protection, both immediate and long-term, for the homeless population. Still in the news, detectives assigned to the Major Investigation Division, MID, are probing the circumstances surrounding the shooting death of 2 men and the injury of another by unknown assailants on Collie Smith Drive, Kingston 12 yesterday. Dead are 24-year-old Tyree Montague, otherwise called Iron Man, of Cyrus Path, and 25-year-old Stephen Beckers, otherwise called Mashi, of Greenwich Park Road, both in Kingston 12. Reports are that about 5:15 p.m., Montague, Beckers, and another man were walking along the roadway when they were pounced upon by armed men traveling in a motor car who opened fire, hitting them. The police were alerted and they were taken to hospital where Montague and Beckers were pronounced dead and the other man was admitted for treatment. Detectives in St. James charged a man and a woman with illegal possession of firearm and ammunition yesterday following 2 separate incidents in the parish. The woman has been identified as 26-year-old Sutania Earl of Norwood Gardens and the man, 33-year-old Lancelot Pessoa, otherwise called Shaba, of Dam Road, Johns Hall, both in St. James. Earl and Pessoa court dates are being finalized. And those are some of the stories making news. We will return with more stories, including details that the National Water Commission, NWC, has paid out $685,000 to its customers for breaches of the guaranteed standards during the April and September 2020 quarters. And news that over 80% of the island's street lights now are smart LEDs, with all island coverage expected by December this year. But first, let's take a break, and then we will join Christopher Scott with sports.